Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
In the treatment of rheumatoid arthritis, disease modifying anti-rheumatoid drugs are present. So what does these DMARDS are also called as disease modifying anti-rheumatoid drugs. What does they do? These disease modifying anti-rheumatoid drugs, they are the ones which will alter the course of the rheumatoid arthritis. If you see, the non-steroidal anti-inflammatory agents or NSAIDs have no effect on the progression of the disease, but they will stop the progression of the disease. But the main problem here is these anti-rheumatoid drugs have minimal effect on inflammation. Because they are minimal effect on inflammation, so thus they are not used as analgesics. So for analgesic action we use NSAIDs. These drugs are mainly used in the early in the course of the disease. Early in the course of the disease we use these drugs, DMARDs, and also they will slow the progression of the disease. It's not that they will completely stop the progression of the disease, but they will make sure that they will slow down the process of progression of the disease. Then in these DMARDs we have the following drugs which can be used as DMARDs. The drugs like methotrexate, penicillamine, sulfasalazine, gold, hydroxychloroquine are the drugs which are used in as disease modifying anti-rheumatoid agents. Among this, the methotrexate is the most commonly used disease modifying anti-rheumatoid agent, and it can and this methotrexate can be used as a monotherapy. Then we can use depenicillamine. Sulfasalazine can be used, and gold is not used nowadays. Okay. Next we have hydroxychloroquine. This hydroxychloroquine is only used if the disease is mild. It is not used for moderate to severe disease, and this hydroxychloroquine, in most of the cases, it is combined with methotrexate, and this hydroxychloroquine has a side effect, or it is toxic to retina. It can cause retinal side effects.
thank you and thank you for watching.